Well, good day. My name is Jodi Scholes. I'm your instructor for the MBLEX review class, the MBLEX review course, and we are in class today studying pathology. Ooh, what is pathology? Yeah, well, we're gonna dig in and dust off some brain cells. Depending on where you went to massage school, this may sound very familiar, or it may be brand new. Just know that it's okay either way, because it is a perfect journey for you. And this perfect journey for today is in 3 parts. The first part, we're going to talk about strategies for taking the MBLEX. So knowing the knowledge is actually not enough. So in the first part of class, for the first 5 minutes or so, I share with you success strategies on approaching the test. Yeah. Then we get into the learning, and that's the bulk of what we do in class is we review and we learn. And today we're learning about pathology. In the final part of class, part 3, we dissect questions. And this is I would say it's an essential part of what you are learning in your preparation for the MBLEX. And that is because we need practice taking a test. We need to practice. And if you're practicing on an app on your phone, that's awesome. We need a strategy. And so part of what I'm bringing to you in these live classes, in these recorded classes, is the strategy so that you can execute your strategy. You can follow your plan. And that gives you confidence. Confidence leads to calmness. If you watch the dog whisperer, Caesar, he talks about calm confidence when we are training a pet. We bring that same calm confidence into the MBLEX. Yeah. So let's talk about a strategy. Then we'll move into our learning. Then we'll dissect some questions. Feel free again to pop questions into the chat if you have them. This strategy I'm sharing with you today is a strategy called control what you can control. This is not popular with friends and family because this gives you the opportunity to start setting boundaries. Yes, boundaries about when you study, boundaries about how long you study. Control what you can control. If you live with other people in your home, how are you going to carve out space, quiet space, for you to study? Hey, look, you may not have learned study skills. I actually need to study in a quiet space. I don't study well in front of the TV. I don't study well laying in bed. That's just me. I actually need a quiet space. And for me, I like to have a timer. I say, all right, I'm going to study for 1 hour and from 12 to 1. And at 1 o'clock, I take a break. I set realistic goals around my studying. And what am I studying? Well, I'm a licensed massage therapist, so I don't have to study for the MBLEX, but I do prepare our PowerPoints for class. And that takes some work. I have to set aside specific time to get those ready. I am studying something. I'm studying Spanish. Estoy aprendiendo cómo hablar en español. Yeah. So I'm learning how to speak Spanish. I think that's what I said. Anyhow, so stretching that mind, this is a part of, well, this is a part of something very special about you. You learn new things. Not everybody does. You learned, no matter what massage school you went to, whether you think it was a 10 out of 10 or a 2 out of 10. You learned something in massage school, and you're here to learn some more. You learn things. You set goals, and you hit them. You meet them. You do it. You're a doer. Not everybody's like that. Give yourself some credit. Honestly, if you're listening to this right now, I know you are a doer. And you're here for direction, for help, for support, for encouragement. That's awesome. In your time preparing for the MBLEX, leading up to taking your test, the strategy, an important strategy, is to control what you can control. And that means your study time. That also means on the day of your test that you are going to control what you can control. Can you control traffic? Nope, sure can't. Can you control what time you leave? Yes, you can. Reminder, you need to be there. You are required to be there 30 minutes early. That's not a suggestion, okay? So leave more than enough time. Hell, have breakfast at a little diner next to the testing center. You get there, get settled. Control what you can control. Nothing new on game day. We talked about how taking a test is sometimes like participating in a team sport, right? And I kind of lost my train of thought on that, but controlling what you can control. Oh, what I was going to say was nothing new on game day, right? So when I worked with professional athletes, specifically DC United, Major League Soccer, NHL, hockey players, there was a rule. And even with amateur triathletes, this was a rule. Amateur triathletes who trained like pros. Nothing new on game day. Nothing new on game day. You don't wear new socks. You don't take a new route. You don't, nothing new on game day, because you want it to be reliable. You want it to be predictable. All right. I think I've driven home that point. And so your strategy is control what you can control. And use your voice. Use your voice. Please be quiet out there if someone's being loud, if that's interrupting your study session. No, I'm going to drive myself. Would you drive me? Controlling what you can control will produce a calm confidence on game day, on the day that you're taking your test. All right. I am seeing people arrive, and so I want to let them in. All right. Just want to make sure everybody's in. Yay. Okay. Now we get to move to our learning. Are you ready? Okay. Let's change our view and share our screen. That's interesting. Here we go. So today, we are going to be seeing some slides specifically from a massage textbook. And the massage textbook was written by these guys, but Lippincott, Williams, and Wilkins. Lippincott, Williams, and Wilkins. Just want to say thank you to them, because they make this information publicly available so that we can review it together. And it's specifically about pathology for massage therapists. I'm going to show you another book cover here in just a few minutes. And that's another, if you have any of your books from school, look up pathology. Our class today is going to be a review of your pathology. So let's get to it. First of all, this is an introduction. It's a review. We're going to talk about pathology. We're going to talk about pharmacology and how those intersect. We're going to talk about particular conditions. What are your session adaptations for those conditions? And pathology is really a fancy way to say disease. or some condition of the body. They have a pathology and it's called something. So we're going to talk about that. We're going to talk about pharmacology, about medicines. Yeah. You'll want to review this. There'll only be maybe 3 or 4 questions on pharmacology on your NBLEX. You may get no questions on medicine, but I want you to see the medicines that our clients are taking and understand the session adaptations that could be required. All right. So we'll define a few. Oh, hello. We'll define a few terms at this point. What is etiology? Etiology is the study of the source or cause of a disease. So someone has a condition, they have arthritis, they have rheumatoid arthritis, they have maybe cancer, maybe they have COPD. So etiology is the study of the source of the disease, what causes the disease. Is it something that is hereditary? Have they been exposed to something? Is this something to do with their dysfunction in their immune system? But it's the study of what has caused the disease. I want to mention the stages of injury and healing because these apply to our session adaptations. Because when we are in the acute phase of an injury, then that is a contraindication. Often it's a contraindication for massage. There are 3 categories of the stages of healing from an injury, and an injury could be considered a pathology. It's a condition, it's an unusual condition. But when you are healing from a disease, when you are healing from an injury, there are 3 stages. The acute stage, the subacute stage, and then the chronic stage. Let's think of this specifically in terms of injury. The acute stage is at the time of injury. You've rolled your ankle, it blows up. It swells. Not blows up, but it swells. You dislocate your shoulder. And that's the acute stage of the injury. Next is about 72 hours, 3 days after the injury, we'll actually know what our injury is. In that first stage, the acute stage, we have a lot of stuff going on in the body, mostly release of hormones. So hormones like epinephrine, norepinephrine, maybe some cortisol, all sorts of hormones get secreted into the body to help us move out of danger, to treat the injury, to trigger the brain to say, hey, there's an injury somewhere in the body. That's in the acute phase, the first 72 hours, typically. After that, it becomes subacute, and we can start to treat, or with a doctor's note. After 3 weeks, it's considered a chronic condition. In some textbooks, it says 6 weeks, but if after a month, someone is still dealing with a condition, it has become chronic. There still might be inflammation, but the acute inflammation, the inflammation associated with the initial injury has changed. It is now a cycle of inflammation that is perpetuating itself. That's in the chronic stage. Oh, my low back, it comes and goes. It's maybe a chronic injury or a chronic condition. Let's stay away from the word injury and call it condition. The reason being is we don't want to label our clients with an injury. Maybe they had an injury, but now they have a condition. You follow me? Right. We have to speak to the mindset of the healing process. All right, let's continue on. Contraindications, remember them? We have both local and systemic, local and general. It could be also general and specific, all names that are called for contraindications. This is an area of the body that we need to identify as either or a condition in the body that we identify as a local contraindication. We don't massage the affected area. Say, for example, a bruise. They're using that here. An open wound. eczema. These are local contraindications. That means there's going to be an area of the body, maybe with eczema. We're going to avoid, the area of the body that's being affected. We just don't want to make it worse, right? But a systemic condition, we actually have to reschedule the massage because the systemic contraindication tells us that it will make the condition worse, or it has the potential to make the condition worse. We don't maybe know why the person has this condition. So the example on our slide is fever. So that is a systemic thing. We don't know why we have a fever. It's in our whole system, though. Our system is fighting something, right? Yeah, and that is the fever response. In a systemic or general contraindication, it simply means we have to reschedule. We have to avoid doing massage. All right. So indication, there's contraindications, but there's an indication for massage. And that is when massage is beneficial. And that is 99.9% of the time, maybe 99% of the time, massage is going to be beneficial. And if you are concerned, the rule for massage therapy is if in doubt, refer out. So if in doubt, look it up, but if in doubt, refer out. Okay? That means refer out to another medical professional who can rule out any contraindications for massage. Now, this is the best practice when you are taking the NBLEX. When you are in practice, you are going to make a judgment call. For the NBLEX, when in doubt, refer out. If this person comes in with a slight fever, that is your cue on the NBLEX that it is a general contraindication. It is systemic, and you have to reschedule the session. Okay? Flu is another general. Uncontrolled high blood pressure. These are all general contraindications. So if in doubt, refer out. Pharmacology. Oh boy. All right. So I will tell you right now, I am not an expert in medicines. I'm not a nurse. However, I have treated, last guess was about 22,000. Last count was about 22,000 sessions that I've done. In fact, I had a session this morning before sitting here with you. Yeah, I'm still practicing. And so I still see health intake sheets with a list of different medicines. So let's take a quick peek at our different categories. So diagnosing and prescribing medicine or in general is out of the scope of practice for a massage therapist. Massage increases blood flow, right? It also can increase the effect of medication in the body because it absorbs faster. In our digestive tract, digestion improves, absorption improves with massage therapy. You've probably heard of the fight or flight, right? We've talked about it in earlier classes, that fight or flight. What you may forget, or what you may forget that you knew, is the other side of that equation. So we've got the fight or flight, but we also, our nervous system lets us rest and digest. And so part of the benefit of massage is the digestive tract increases absorption. Therefore, it could increase the effects of medication because if it's a time-release medication, again, it increases blood flow. It increases the delivery of that medicine to the body. It also can have the opposite effect. If someone is on insulin, it might spike, not their sugar, but their absorption of the insulin. And so they may feel a little bit like they've got low blood sugar or high blood sugar. So it can affect the absorption of medicine, is the point I'm making. So medicine is categorized by its purpose. medicine is also categorized by how it works, by its mechanism. We're going to pause here for just a moment. All right, for just a moment. Sorry. I can't quite see what I'm doing, so. All right. Oops. Thanks for your patience. I think you guys have seen me in technology sometimes as we have to have a longer term conversation. All right, let's do this. Okay, I think that's, we are, aha, there's our concern. All right. We are back on track. So what you'll need to do for the MBLEX is to learn some classifications of massage. And also the effect that massage has on that medication. And a great way to do that is to have handy, either online, on your phone, access to the physician's desk reference. It's a book, actually. You can get the book. I think it's like $70 or something now. And that's called the physician's desk reference. So here is an example of it online. And you can see here that it allows you, so the physician's desk reference, PDR, here I've searched a drug. Say you had a client who came in and said, hey, I'm on Xanax. And so you can type in the name of the drug here. I typed in Xanax to search it, and it tells you what class of medication it is. So it's a benzo, I don't know how to say the whole thing, benzodiazepine, most likely, but it's a benzo. And so that's going to affect anxiety. We know most benzos affect anxiety. And that's usually what Xanax is prescribed for. But in case you can't remember that off the top of your head, you can go to the physician's desk reference and you get all this information, a few pages of information on the medication that your client's on. Or you can simply ask your client. But we do need to understand what medications they're on and why. For the MBLEX, you are going to need to know some classifications of medicine. So, for example, benzos, benzodiazepines, they are normally for anxiety. Let me show you one more picture of this PDR. And this is, you do have to create an account to register. It's free, but then you have access to seeing all the medications online, and they do have an app. It could be helpful for your practice. Personally, I ask the clients, what are you taking it for? What's it for? Now, that didn't work out so well for me one time because I didn't recognize a drug, and the client, a male client, large in stature, we say he was a man of large carriage, he put down the medicine. It was for ED. And I was like, what are you taking this medicine for? And he said, ED. And I said, okay, what's ED? Well, it was erectile dysfunction. Yeah. So glad that he mentioned it. Not that it was necessarily going to be affecting the adaptation for the massage, but it was a moment of a little bit of embarrassment for me. But I got over it quickly. I was like, okay, cool. Is what it is. So anyhow, your reference for medications in practice, but we're going to review a few categories of medications right now. Okay, got some anti-inflammatory drugs. So these are things that you have in your medicine cabinet right now. Aspirin, Tylenol, ibuprofen, corticosteroids, cortisone. Some people are prescribed cortisone if they have like poison ivy and they've had, a big inflammatory reaction. Cortisone is helpful to control the swelling. Codeine, another anti-inflammatory, Excedrin. These are all anti-inflammatories, sometimes called NSAIDs, NAISDS, NSAIDs. It's anti-inflammatory steroids, non-anti-inflammatory steroids. Um, excuse me, it's non-inflammatory steroids. Oy, okay, NSAIDs, but aspirin, Tylenol, ibuprofen, those things you have in your uh, medicine cabinet. Let's continue on with our pharmacology, and there are some categories of muscle relaxants. So the session adaptation for a muscle relaxant, um, for a muscle relaxant, is um, to monitor the pain levels. The reason I'm asking about that, or I'm talking to you about that, is because when a client is on a muscle relaxant, they sometimes lose their perception of pain, but they also lose their perception of pressure. I've had clients who have said, yeah, I can barely feel that. Can you go deeper? And yeah, I can go deeper, but does the client actually know how deep I'm going? If they are on a muscle relaxant, that can be a challenge. So we have to check in, we have to monitor the pain level, and we also have to monitor how much pressure we're using. So some examples of muscle relaxants are Flexerol, and that's works with the skeletal muscles. These both do dantrium. So Flexerol, you don't have to know this part, but just know that Flexerol and dantrium are muscle relaxants. So you're in that category. If you see these questions on the MBLEX, it will particularly speak to a session adaptation. There are crazy questions. There are crazy questions that ask you to name the generic name. Yeah, the generic name of the drug. But if you're getting that kind of question, then you can kind of celebrate a little bit, because that means that you've actually answered a bunch of questions right, and you're getting a tougher question. But let's continue on. All right, cardiovascular disease management. So these are drugs that help people regulate their cardiovascular system. So these would be heart conditions, blood pressure. These often make the client feel like doo-doo, fatigued, sluggish, foggy, dizzy. And so massage can actually increase that feeling. Because again, massage increases blood flow. It's increasing the amount of medicine that is in their system, that is active in their system. So a session adaptation might be to let the client know they may feel dizzy, to get up off the table slowly. Lipitor is an example of a cardiovascular medication. We have also beta blockers, um, antihypertensive drugs, which speak to high blood pressure, diuretics that help to eliminate, to make a person to urinate more. Diuretic makes them urinate more to help, again, regulate pressure, but also eliminate waste. So there you go. Those are some cardiovascular medicines. Antidepressants are another category of medicine, and some side effects of that could be constipation. So this I've heard is on the MBLEX quite a bit. Constipation can be a side effect of an antidepressant, and we can treat that with massage. Did you learn abdominal massage in school? Have you practiced any of your abdominal massage? Start with yourself. If it's been a minute since you learned abdominal massage, what do babies do, right? What do kids do? Oh, my belly, right? A little rub the belly. Yeah. And so we move in a clockwise fashion with your head at 12 o'clock, your feet at 6 o'clock, and we move in a clockwise fashion. And that's, if you haven't learned the colon stroke, you can look it up. It's called abdominal massage or the colon stroke. But it follows, and we'll talk about, we'll see the colon in just a minute, so we'll come back to that. But that's how massage therapists treat constipation, is they massage the stomach. And there's a specific technique. I'll mention it to you a little later. Uh, and so there's the off chance that massage can change the chemicals in the brain as well. It does change the chemicals in the brain, but the slight chance of it affecting the client's response to medication is very low. But it could be there, especially with antidepressants. So there's a certain brain chemistry. Client is on an antidepressant. Again, because we are very efficient as massage therapists in eliminating waste, um, we get rid of some of that medicine more quickly, and it can change the brain's chemistry. So common classifications are here in front of you. Altinortriptyline, antidepressant. Prozac is a very common antidepressant. This is called an SSRI, a selective serotonin reuptake inhibitor. I know. When you hear those words, if you hear something about serotonin on the Amblex, think antidepressant, if it's a medication. Okay? All right. Anti-anxiety. So antidepressant is different than anti-anxiety. So with the session adaptations, you're going to want to just watch for the side effects, okay? And adjust for those side effects. The client says, wow, I went on this anti-anxiety medicine, now I'm dizzy. Now I feel a little depressed. Wow, I don't have really good coordination since I went on this anti-anxiety medicine. That will be our session adaptation. We will help them on or off the table. We will watch for dizziness. Yeah, um, so especially getting up on and off the table with anti-anxiety medications, they can feel a little dizzy. But common classifications for anti-anxiety, a barbiturate is an anti-anxiety. It helps to calm the system down. Benzos like Xanax is an anti-anxiety medicine. And Buspar is another anti-anxiety medication. And I can hear you writing furiously, right? You can review the recording. You can review common medications. In fact, I'll put a document with the video this afternoon that gives you common medications. It's about, I don't even remember how many are on there, but there are classifications of medicines that it's good to be familiar with. Do you have to memorize the whole list? No. Don't waste your brain space. You're not becoming a nurse unless you're becoming a nurse, right? But knowing the session adaptations for that medication is what you'll be tested on with the Emblex. All right. So anticoagulants. These are typically something that's going to help to avoid clots. Anticoagulants. So it is considered a blood thinner, but it is also to help avoid clotting. So this client has had an issue with clotting. So this can be a systemic contraindication. Unless the client has already been cleared by a physician, that they are not a threat for blood clots. So deep vein thrombosis occurs when there's a clot in the lower leg, in the leg. I guess it can occur really anywhere, but mostly it's in the legs. And when they are on an anticoagulant, they may just feel like weak after the massage. So you may have seen these classifications of medicine, warfarin, otherwise known as Coumadin, that is an anticoagulant or a blood thinner. That's probably the most common one. Miradan is showing up a little bit, but mostly we see Coumadin. So a quick pause here to shout out to Ruth Werner, who, if you have this book, it is wonderful. But it is thick. It is a lot of detail. You don't I mean, it's good to have as a reference for when you practice, but you actually don't need to memorize it, okay? There are gonna be, I think, 16 questions on pathology, and they could be anything, any condition, any disease. But remember, this is a massage therapist's guide to pathology. And typically, this is going to be your session adaptation, something you're going to need to use your brain for, think, use your critical thinking and say, okay, he's on Coumadin. I'm going to adjust my pressure so that I don't bruise him, especially if they're older, right? If they're older. So we want to understand medications as they relate to session adaptations. This is just a fun slide. Did you grow up? Did you know about the game Operation? Sometimes pathology can feel like this. This is like all the different things this guy has wrong. Okay, my leg hurts. I get a Charlie horse. I need to be gluten free. I just thought it was super funny. But it's the game. It's a game called Operation, and you're supposed to put like the bone. You have to use tweezers to put the bone where the funny bone would go. All right, just a little light humor because we didn't get a lot of pictures in our slides today. Last couple of slides on pharmacology. We've got some anti-infectives. People are taking this because they may have an infection. So massage, I mean, this will affect their GI tract. It can cause constipation. It can cause an upset stomach. We want to understand if they are battling something, and we'll talk about one particular condition here shortly. But massage can help to reduce the symptoms of the GI tract. So the GI systems, the gastrointestinal tract. So someone has an upset belly, they're constipated, they're diarrhea. But the drugs that typically we see here for infection, penicillin, Tamiflu, um, and Amphotericin. So penicillin treats bacteria, Tamiflu treats viruses, and so those can really be upsetting on the belly because, for example, penicillin changes the chemistry inside your belly to help kill the bacteria. This is why you may have heard of some people going on using yogurt when they are on a penicillin. Have you heard that before? That people will eat yogurt, or they will take the drink kefir to help establish good bacteria back into their belly. That helps with the balance of the bacteria, but that's a whole nother story for another day. But that's why there's GI tract issues. And so we'll want to use a little bit of a gentler technique with people if they're on penicillin, because we don't want to stress out the body. We would just want to adjust, maybe a little bit more gentle so we get that rest and digest response. Yeah. And beware of fixing it. Oh, I want to fix this today. Let me remind you, as massage therapists, we don't fix anything. We don't. We don't fix anything. We facilitate a space where the body heals. Let me say that again. We don't fix anything. The body heals itself. The body wants to be whole. The body wants to be in homeostasis. We facilitate a space where the body can heal. We increase blood flow. We increase the autoimmune effectiveness. We increase digestion and absorption. We activate the parasympathetic nervous system. You're a freaking rock star. Doing massage, it's really good for people. Yeah, but we're not fixing it. Yeah, we may work out a trigger point, but yeah, that feels good and it helps a person. But just know the body is working towards healing all the time. There's just a priority of what that body needs to work on. So when that client comes and gets massage and we facilitate this space where the body can do what it does better, that's our role. Okay. Sometimes I get on my soapbox. So the GI issues, also I wanted to mention again that massage can spike symptoms, can spike those symptoms because there's higher concentration of waste material in the bloodstream. And so as the body detoxes, there can be a higher concentration of whatever that person's body's trying to get rid of. And there's lots of different metabolic waste. Lactic acid, we hear about that all the time, right? But there's uric acid, there's carbon dioxide, there's environmental things that we get exposed to. Have you ever smelled something and then gotten a headache? Yeah, the body has to clean that out of your system. And it does that through the bloodstream and through breathing. Yeah. So massage has the potential to spike a symptom because we increase the concentration of it in our system. All right. Back to your regularly scheduled program. Let's talk about the GI tract and diverticulitis. Diverticular disease. So maybe you've heard of diverticulitis, but it's an upset stomach. But it's diagnosed because you have inflamed diverticula in the digestive tract, and I'll show you a picture of this. There's an increased pressure in the bowels, and then this pushes through the wall lining, and it's a similar concept to what is that called? It's leaving my head. Sorry. So a client can have diverticulitis and not even know it. They may be asymptomatic, but often left lower pain, so left side of the abdominal area. That's where they sometimes feel it. They may probably have gas, nausea, a low-grade fever. They'll be irregular with their bowel movements. But take a look at the two descriptions here, diverticulitis and then osis, okay? Right here under signs and symptoms. Diverticulosis, more mild. Some constipation, a little bit of blood in the stool, nothing major. Diverticulitis, itis, remember itis, arthritis, bursitis, spondylitis. Those are itises mean inflammation. Itis, that suffix means inflammation. And so here we see inflammation of the diverticula. This is an anatomical part of your colon. Let me show you the picture of your bowel. So the picture will be coming momentarily. Treatment for this is basic. The person is changing their diet, but that's not always successful. They may take a stool softener if they're experiencing constipation. And depending on if it's truly an infection of the diverticula, then they'll need to be on antibiotics. And some people even, it's bad enough that they have surgery. Diverticulitis is also made noticeably worse by stress. And so by controlling the stress, they can control their symptoms. So massage is contraindicated in the acute state. So if they have a flare-up, right? So in the acute state, just leave it alone. But if they are asymptomatic, then we can do massage on the stomach. So we want to avoid like rigorous massage on the stomach, especially with older clients and constipation. They can be more frail. But that's diverticulitis. Here's a picture. So these are the diverticula, these little round things on this section of the sigmoid colon. So this is the lumen, but we have the ascending, transverse, descending. This little area here with the diverticula is called the lumen. After descending, lumen, sigmoid, and then the rectum and the anus. So this is how we poop. Yep, this is where it goes. So ascending, transverse, descending, the little lumen area, which is where diverticulitis affects. These little red dots are normal, but sometimes they can get infected or they can become irritated. So diverticulosis, OSIS, is milder than diverticulitis. All right. We have more pictures. Okay, let me move us down here. Yeah, so you can see how this is so when these pouches become inflamed is when it's red and inflamed. They're always bumpy and look weird, but when they're inflamed, that's when the itis, the diverticulitis. So yeah. So like it says, serious, severe, or reoccurring diverticulitis can actually damage the colon, and could require surgery. And it's uncomfortable. Don't let me kid you. Diverticulosis is milder, but when someone has this, it can be very painful. It can keep them from going out. It can, I mean, it can be, it's a real thing. Last condition for today. So we are going to talk about Dupuytren's contracture. Probably can say that, but look at the spelling, Dupuytren's contracture. And this is a contracture of the hand. You may know someone with this. Let me show you the picture. And we'll come back to that. See this area right here? This is the contracture we're talking about. It has a name. It's called Dupuytren's contracture. It is a progressive condition. It's a thickening of the tendons in the palm. And we often see it with the ring finger, and it results in contraction of the fourth and fifth. But it can sometimes be the whole hand. They don't know why it happens. Yeah. So you'll see the signs and symptoms. Remember that signs are what we can see. I see a sign. Clients tell us about their symptoms, right? I can't tell you what symptom you're having. The client has to tell me the symptom. I can see the sign, I can see the contracture, but I don't know, does it hurt? You'll have to tell me what your symptoms are. So you'll see dimpled skin, you could see that thickening, cord-like bands in the palm, and it can be, the joint can be inflamed. And it can be one hand or it could be both hands. This is again the example. So this is more common, actually is more common in older men. People who have another condition such as diabetes or epilepsy. And it could also be because they don't really know what causes it, but it could be a result of their work. So repetitive stress, forceful gripping of tools, those types of repetitive stress may contribute to this contracture. I got a lot of other options on treatment other than surgery, right? It's musculoskeletal. We can warm it up, people. Yes, okay. We can help someone avoid painful surgery. Often, though, when a doctor sees this, they recommend splints at night to keep their hand open. So you will want to avoid massage if the client's taking an anti-inflammatory because we don't want to create more of an inflammatory response. If there is inflammation present in the joints, if it's hot, if it's red, find some ice. I used to keep ice packs in my office, the kind that you twist, you hear the pop, and then it's cold. It's a very nice add-on, and they're cheap as dirt if you go to the local drugstore, Walgreens, CVS, Rite Aid, whatever. Just go get a box of them. It's like $10 for 10 of them. It's the kind you twist. You may have seen it if your kid plays sports, like baseball or football. They have them in first aid kits, right? Because ice isn't always available. So very nice to have in your office just in case. And also, if you can get a hold of some, are moist heat packs, moist towels. So a towel caddy is another option for treatment for Dupuytren's contracture to warm it up. Feels so good, honestly. Oh, and we can apply friction. We can actually do some friction massage. And if there's inflammation, not always followed by ice, but if there's inflammation or the client's going to be sore because you went crazy with the friction, then they can use some ice. And here's another visual images of what's happening. So usually it's right in this part of the hand, and this is a picture of the thickening tendons. Ooh, here we go. This is supposed to say dissecting questions. All right, let's take a look. We are about to transition into dissecting questions. Woohoo! All right, so what is etiology? This is your first question. We are simulating your MBLEX experience, and we are going to dissect questions. Dissect meaning, what does it actually mean? And also, let's get rid of as many wrong answers as we can. Hopefully, we get rid of at least one, if not two, wrong answers that we know are wrong. So let's take a look. What is etiology? I've spelled it phonetically for you there. Etiology. Eee-dee-ology. It's actually eee-dee-ology. Okay. The study of, what is it? Is it the study of biological evolution? Is it the study of bugs? Is it a speech with very nice words about someone? Etiology. The study of the causes of disease or abnormal conditions. So in the chat, oh, I see answers. Right, Amber. No to bugs. Exactly. So we can eliminate the bug question, right? So no to bugs. Oops. I thought that was first. So yes, it's no to bugs, but a speech with very nice words is called a eulogy. Bugs are called etymology. So no to bugs and no to the speech, right? So we know that we're being tested on health-related information. So now we only have two left: the biological study of evolution or the study of causes of disease and abnormalities. Hint, hint. It's what we're studying today. Hello. All right, so A or D. Go ahead and put your answer in the chat if you're ready. Yay! Yay, Amber. Yay, Jessica. Yay, Kiara. Yes, yes, Devana. Yes, you guys are getting it. Boom. Etiology is the study of causes of disease and abnormal conditions, the study of pathology. So a pathology is a disease. So the study of the causes of pathology, right? So we're starting to be able to understand what these words actually mean. So the study of the causes of disease or the cause of an abnormal condition or lack of health. All right, good job. Okay, what is a concern about working with a client who takes the medicine Lipitor? We mentioned Lipitor today. What was it? All right. As an anticoagulant, let me put us down here so we're out of the way and you can see the question. So as an anticoagulant, I would adjust my pressure to avoid bruising. Lipitor. As an antidepressant, I would check in with the client regularly, but no pressure adaptation is necessary. As an antihistamine, I would monitor the client's breathing. As an anti-inflammatory, I would avoid techniques that cause more inflammation in the primary areas of concern. Okay, this is such a great question because it's so much like what you'll see on the MBLEX. The answers are anyhow. Okay, so dissecting the question. The question is about Lipitor. What is a concern? What is a concern? So what are we going to watch for, change? What are we going to be concerned about if the client is taking Lipitor? All right. So what do we know Lipitor is not? So do we know for sure it's not an anticoagulant, an antidepressant, an antihistamine, or an anti-inflammatory? Do we know for sure it's not one of those? Let's see if we have anybody chiming in the chat. Not yet. Okay. Well, I'm going to give you the clue because it ain't an antidepressant. Okay? So we can get rid of that one. And Lipitor is not an anti. When you know somebody on Lipitor, what's the reason they're on Lipitor? Do you remember? You do. You're about to remember. Okay. But what do you think about antihistamine? Is Lipitor for the lungs? Is it to help with breathing? Hmm. Is it an anticoagulant? So is it something people take so they don't get clots? Does it have to do with the blood, Lipitor? As an anti-inflammatory. Is Lipitor an anti-inflammatory? Hmm. Is it? Does it affect inflammation? Does that make it easier? Yeah. Okay. I think you know the category of drug this is. Let's take a look. Let's take a look. It's an anticoagulant. So Lipitor is often the drug that a client could be on to help them control their circulatory system to avoid clots. And it's really in your head. I want you to get this straight, okay? Blood, nervous system. All right, we've got the blood, we've got the brain, we've got the breathing, and we've got the nervous system. Or the muscular system, right? So anticoagulant is with the blood, antidepressant with the brain, antihistamine with the breath, anti-inflammatory, either it's a musculoskeletal condition, nervous system, musculoskeletal, right? So Lipitor is to help with the cardiovascular system. All right. Starting to see categories, right? You're starting to see these categories, these what they call classifications. If you know what body part it helps or what system it's supporting, you can help to get to your answer. Okay. So, changing gears, your client arrives and says they're tired and they have a slight fever. What is your first adaptation for this condition? Let's take a look at this question a little more carefully. Your client arrives, they say they're tired and they have a slight fever, and they think they have a slight fever. What is your first adaptation? All right. A, ask if they have other symptoms. B, advise them they may feel worse before they feel better due to the metabolic waste that's about to be dumped in their system. C, fever is a general contraindication. It's best to reschedule the client. D, fever is a local contraindication. Avoid doing work on the head. What you got? I see some answers being posted. Amber, I like where you went. Jessica, I like where you went. Yes, let's move through this. Okay. Fever is not a local contraindication. And I mean, avoid working on the head. That's a little odd. Fever is a general contraindication, and it's best to reschedule the client. In your personal practice. Yeah, exactly. Don't risk it. You can't risk it because you don't know why they have a fever. So Amber says, don't risk it. No, you can't. And look, I don't want to tell anyone they can't get a massage. But if they've got a fever, they're going to feel awful when they get done with the massage because we're going to spike their symptoms. Rather, let their body go through its natural healing cycle. Give their body permission to not get a massage today and feel worse. Yeah. Plus, we don't know if they're contagious. And so fever is a general contraindication. And you may go ahead and ask them if they have other symptoms. You may advise them that they're going to feel worse. But the answer for the MBLEX is reschedule the client. All right. On the health intake sheet, your client checks the box informing you that they have diverticulitis. What is one of the first questions you'll ask? What is one of the first questions you would ask? Again, the MBLX is tricky. And so in this questions, what's one of the first questions you're going to ask? So we're going to use our critical thinking skills here. What's the concern about diverticulitis? We just talked about diverticulitis. We know it's those bumps in that lumen part of the colon that can be inflamed and be causing all sorts, wreaking havoc in the belly, gas, and could be infected, could be, I mean, heck, with bad situations, it's surgery. What's our concern as a massage therapist? That's going to be one of the first questions we'll ask. So let's take a look at our options. A, how long have you had the condition? B, are you in any pain right now? C, is it uncomfortable for your eyes to lay down in the headrest? D, is this hereditary? Do you think you got this from hereditary? Okay, I see some brave souls putting answers in the chat. Right. It doesn't involve the eyes, right? So let's take that one out. So this has nothing to do with the eyes. It sounds like something that does, and I couldn't remember what the word was, but it's tricky. The MLX is a little tricky. It's trying to trick you. It's like, wait a minute, does this have to do with the eyes? No, it doesn't have to do with the eyes. It has to do with the belly. Okay. I see you. Ooh, you got it right. Oh my gosh. Let me see one more. Yes. Jessica, yes. Shay, yes. Amber, yes. Because the answer is, are you in any pain right now? That's the first question, because our concern as a massage therapist is that they're in a flare-up. If they are in a flare-up, it's contraindicated to do the work. It's definitely contraindicated to work on the belly. But if they're in a flare-up, they're just, have they seen their doctor? And so we need to explore this a little bit more, this pathology, because they could be asymptomatic. They could be no symptoms at all. Great. We'll proceed with the massage. But if they're in pain, if they're having a flare-up, in 9 out of 10 cases, we're not going to be able to do the massage. This is true of lupus. This is true of fibro. This is true of diverticulitis. If they're in the middle of a flare-up, to be honest, they're not going to want a massage. Yeah, because it's that uncomfortable. But that's our first question. Are you in pain right now? Good job, you guys. Oh, all right. Last question. Thank you for hanging in. If you need to scoot, it's a little after 1. So you discover a condition in your client's hand that looks like Dupuytren's contracture. Dupuytren's contracture. You discover a condition in your client's hand that looks like this contracture. What's your session adaptation? What are you going to do? All right, let's take a look. Man, you know what this is now, so you're going to identify it and diagnose it and recommend the client goes to see a hand specialist. Because if they haven't been to a hand specialist, they need to go. B, don't say anything. It's out of the scope of practice. C, identify the signs and recommend to see a doctor. D, work on the tight muscles, monitor the condition when you see the client. You're monitoring the condition when you see the client to see if it gets worse. Critical thinking. Critical thinking. What is your session adaptation? Let's take a look. Oh, I see some answers coming. I see some answers. All right, let's get rid of one answer that we know isn't right. So we're not going to identify and diagnose, right? When you see diagnose or prescribe, it's out of the scope of practice. We cannot diagnose it. We are not allowed. We can recognize it. We can see signs of it. We can work on it. What is the best answer for a session adaptation here? You guys are on it. I'm going to check the chat one more time. Boom, boom, boom. Ooh. Ooh. Okay. Yes, thank you. All right. I want to make sure that we had the right answer. People had the most recent answer I wanted to see, and you guys are correct. Let me show you. Boom. Identify the signs and recommend to see a doctor. Yeah, and we don't have to be alarmist about this. We don't have to call it Dupuytren's contracture. We can say, I see some signs in your hand that remind me of a certain condition. Have you seen a doctor about this? What do you see? Well, I see some tightness in your muscles. I mean, and in some of these cases, it gets progressively worse. It'd probably be a good idea to see your doctor. I am not alarmist. We are calmly referring them to a doctor. Okay? Yeah. So if you see something like that in, the best answer is we identify that as a sign. It's not a symptom. We don't know if he has any symptoms. Does this hurt? That would be a symptom. No, it doesn't hurt at all. Just looks weird. Okay. That looks like a condition I've seen before. Have you seen a doctor about it? Or it looks like a condition I learned about in school. Um, have you seen a doctor about it? Nah. Okay. Um, well, it looks like a condition that could progressively create more tightness in your hand. I'd recommend that you have a on your next doctor visit that you have it checked out. We don't want to be like, you got to get to the hand doctor now. No, on your next doctor's visit, point it out, see what they have to say. I mean, we stay calm. When in doubt, refer out. And in this case, it's not a life-threatening situation. And so we can um, identify the signs and recommend them to see a doctor. All right. Boom. That's a wrap. Yay. Good job today. Oh my goodness. That was a lot, right? Honestly, honestly, pathology, oof, it can feel like you're getting kind of a lot of information. But when we break it down, when we make it into small bites, hopefully it's easier for you to take in, to imprint how it's going to impact how pathologies can impact your session. Um, so good job today. Yay. Boop, 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 boop. I'm going to have a final greeting to wrap up our recording, and I'll stay on for a few minutes if there's specific questions. My name again is Jodi Scholes. I am your instructor for the MBLEX review course. It is my pleasure, my privilege to remind you of stuff you've learned, to walk with you down a path of maybe some new learning, but to remind you that you're on this path for a reason. And um, I'm excited for you. I am happy for you. I'm looking forward to you having a calm confidence when you prepare, when you arrive, when you take, and when you pass that NBLEX. Yeah. All right. We'll see you next week. And yeah, we'll see you next week. And till then, happy studying.